Hey, I'm Anastasia, and this is Anastasia's Hump Day Happenings. I'm here in freezing Buffalo, New York at East Amherst Dental Center, and I'm here with Dr. David Rice. And you know, the recent tragedy that happened with, in the state of Hawaii, a 3-year-old patient had passed away in the care of a dental professional. And my concern is that we're not addressing this enough and how we can prevent it in dental offices. So, Dr. Rice, what would you do in sharing with patients? Like, how do you prevent this from happening?
You know what, Anastasia? I would tell you the top 3 things that come to my mind are make sure I'm giving a parent a great education on nutrition, on home care, and on routine dental visits themselves.
Oh, all right. So we got the nutrition part. So tell me a little bit about that, just so people can know, what does nutrition have to do with a 3-year-old?
A lot of factors with nutrition, but the 2 biggest things that come to mind are frequency of sugar intake, as well as don't put your child to sleep with a bottle that either has milk or juice. If
That's
anything,
going to be
it's water.
hard.
It is going to be
They're
hard.
used to that. So,
Yeah.
all right. So no milk and no juice to have at bedtime throughout the night. What age should kids come into a dental practice?
I'll tell you, we like to see kids as soon as that first tooth comes in. Sometimes parents think it's a little bit too young, but a lot of it is about the education of a parent, because we don't know what we don't know.
Right.
So helping them with a dental education is important.
All right, so I'll be a devil's advocate. Let's just say you have a parent comes in and they did give their child juice and sugar and all that kind of stuff before bed, and they're over their first tooth. So they've got their full dentition at 20 teeth, and they have a lot of decay. Where do you refer them?
Most important factor for us is making sure as a patient that you're in the best hands. So in the scenario that we're discussing right now, I'm going with a board-certified pediatrician if I see a child who has that level of dental needs.
Okay, and is that taken care of in office, or is there another place for that?
I have to believe with a child that age, the safest environment is a hospital OR. You can control the conditions and all the risk factors that could evolve. It's not about what happens when things go well, it's about when things go wrong.
So those are places that are prepared for emergency situations.
Absolutely. If something negative is going to happen, they're ready for it.
Oh, that's awesome. Well, I appreciate your time in sharing this. So again, it's about nutrition, frequency of visits, and know where to go if your child does have more to take care of than the average 3-year-old child. So I want to thank you for your time today. If we want to get a hold of you, how can we do it?
Easiest way is to get a hold of us at eastamherstdentalcenter.com, or you can find us on Facebook.
Sweet. Now, till next Wednesday, you've got an oral health question on your smile. Please ask it right down here or send me a private message. And until next Wednesday, take what you learn and make a difference with it.